Okay, so another topic is asthma. Asthma is defined as chronic inflammatory reversible disorder. Chronic inflammatory and reversible disorder means it is reversible within very short span of time with the help of inhalers. It can be reversed, and it is airway hyperreactivity and caused by obstruction in airway outflow. Now what happens, as you can see, these are the normal bronchioles and bronchi. When these become hyper responsive and obstructed, then asthma develops. So in this way, asthma can be defined. The clinical features of the asthma are wheezing, breathlessness, cough, and episodic diurnal pattern of shortness of breath, most commonly in early morning. Wheezing during inspiration and expiration is the common finding on examination. Exacerbation of the asthma is associated with the tachypnea, tachycardia, use of accessory muscles of respiration, and diaphoresis means sweating, and fatigue will be there in the patient along with pulsus paradoxus. So the triggering factors for the asthma can be respiratory irritants, smoke, perfume, allergens, infections like upper respiratory tract infection, sinusitis, drugs, aspirin, emotional stress, exercise, cold temperature, and air pollutants. These are asthma exacerbating agents. These can trigger the asthma. So asthma plus syndromes means asthma along with other syndromes, and when atopy is there means asthma and allergic rhinitis plus atopic dermatitis. This is the triad of atopy. Another is Churg-Strauss syndrome, which is asthma plus eosinophilia and granulomatous vasculitis. Aspirin sensitive asthma or Samter syndrome is asthma, aspirin sensitivity, nasal polyps. Allergic bronchopulmonary aspergillosis occurs when asthma along with pulmonary infiltrates and allergic reactions due to aspergillus occurs. So these are the different disorders associated with the asthma. Now, how can we diagnose the asthma by we will look at the obstructive pattern, and diagnostic criteria of asthma are by methacholine challenge test and CBC skin test, and IgE level are also looked, because asthma can also can be caused by hyperresponsivity, hyperreactivity, allergens, and autoimmune mediated. So IgE level should also be looked. See, skin test is performed. CBC and methacholine challenge test is also performed in asthma. Methacholine is bronchodilator, and methacholine challenge test differentiates between asthma and COPD. Now, the treatment of asthma is, first of all, educate the patient about avoidance of triggering factors like allergens, pollens, and perfumes, and pets should be kept away from the asthmatic patient. And then, if patient develops, then inhaler should be given, like inhaled short-acting beta agonist is the treatment of the choice. SABA like albuterol and terbutaline, salmeterol should also be given, and low dose corticosteroids should also be given, like leukotriene, and mast cell stabilizers should also be given to the patients. In this way, we can manage the patient of asthma, and we can save the life of a patient. So we discussed that asthma is hyper responsiveness of bronchi, and there is chest tightness along with wheezing, and shortness of breath is there in the asthma. But the most important thing is it is reversible, means with the help of inhalers, with the help of short acting beta agonist, we can help the patient to relieve and reverse this condition. We can also give mast cell stabilizers along with corticosteroids in form of treatment, and we can save the life of the patient. So this is asthma, and we can treat by uh, different medication regimes like SABA, LABA, and corticosteroid dosage.